My name is Auden. My pronouns are they, them, elle. I'm a civil rights lawyer based in Washington, D.C. I work on advancing labor and education rights, especially for LGBTQI students and workers. My mom actually was diagnosed with a pretty aggressive form of cancer. The main thing that she was interested in was having me get screened for the same type of cancer. And it turned out that I really needed it because the time between that ultrasound and the screening that finally led to my diagnosis showed that in just those 6 months, I had developed a tumor. I was 30 and I was just turning 31. I got diagnosed with a stage 1 tumor. So I had an invasive tumor in my chest right here above my heart.
Watching Auden go through cancer was very frightening and painful because it's much harder to see your child suffer than it ever is to suffer yourself.
Within 48 hours of getting a cancer diagnosis, I was on the phone with a specialized oncologist. She said to me, you know, the first thing that's going to happen is you're going to have to go off of hormones, because I was getting synthetic hormones to affirm my gender. And that was kind of crushing to realize that along with all the other things that were changing in my life, I was losing my access to healthcare that had really made me feel like myself. The cancer cells are actually feeding on sex hormones. I understood that it was essentially mandatory.
I think one thing that we kept running into was that we would keep having issues where the doctors we spoke to didn't have confidence or knowledge about the various interactions with HRT procedures, and how they interacted with the cancer treatments.
I kind of recently had an oncology nurse say that she was interested in trans healthcare and asked about my experience in a way that showed she really bought into a stereotype about HRT that was just false. It was discouraging to be asked to educate a healthcare provider during my own appointment. Another example would be when my cancer surgeon said that I had the option to have a plastic surgeon there to help with reconstruction stuff. I said I'd like to see photographs of this specific type of procedure and this specific type of result. And they showed me a binder that didn't have any of those results. And the way that they talked about my body and wanted to touch my body kind of led to me feeling that it would actually be really, really bad for anyone from this office to be anywhere near my operating room.
It's become such an intrusive issue where a particular body part that you don't necessarily want to focus on or acknowledge as much sort of becomes a center of your life. It's so important for healthcare teams to acknowledge that, to understand it, and to not just to treat it as like any chest that comes through. You know, we treat the cancer, we move on, because it comes with a heavy context.
After I finished recovering from surgery, I was lucky to find out that I didn't need to have chemo or radiation. I have been pronounced cured. My cancer was detected at a very early stage. We're in a time of unprecedented backlash to the gains of various civil rights movements right now. The anti-racist movement is facing a very large time of repression. But what's unique right now is that trans people are a group in the US that has won recognition of our dignity, our humanity, and our right to live full public lives as ourselves. And we are now seeing those rights eroded and rolled back in ways that are distinct and are unlike other fights throughout history. Many people have recognized DC and Maryland as slightly safer jurisdictions, and the infrastructure that exists in DC to serve the LGBTQI community is under incredibly heavy strain. There is a lot of stress on grassroots LGBTQI, especially trans-led community organizations, to feed and house and clothe people, to connect people with finding jobs and just getting settled when they may show up with needs for, let's say, healthcare, and the systems to meet all of those needs are not fully funded. This is the biggest wave of internal displacement that the US has seen since the Great Migration. There are more people of good conscience than there are people who are completely consumed by their fear and bias. And we can see that in the reality that as much as you may read in headlines about the many hundreds and thousands of anti-queer and trans policies being advanced every state session, over 80% of those policies are being defeated. And it's not just by people like me. They're being defeated by folks who are organizing on the community and grassroots level to say, we will defend each other, and we will keep us safe.
I'm extremely proud of Auden because they are living their values.
It's so important to acknowledge people's gender identity, their transness, because it changes everything about their care.
As soon as they were on their feet, they were like right back at it again and working on like queer legal issues and helping people out and continue to expand their efforts.
As far as LGBTQI folks, like recognizing that when you're dealing with a medical crisis, you actually may not have time and grace for people who don't get you. It took some time for me to realize that even though I was very much at a loss and very scared, and I felt like I needed to rely on experts, I also needed to maintain a confidence and trust in myself